You can start now.
Okay. Brothers and sisters, Assalamu alaikum wa rahmatullahi wa barakatuhu, and welcome to a new episode of Talk with a Professional. My name is Hassan Al-Muadhin, and I will be your host as usual. My guest today is Dr. Manar Kabbani. Dr. Kabbani is a general dentist currently residing in Dallas, Texas. His passion for serving others through healthcare, hands-on work, and an entrepreneurial spirit for business led him to pursue dentistry. Born and raised in Tulsa, Oklahoma, he attended Peace Academy, Tulsa's only Islamic private school. After completing an associate degree at local community college, he earned his Bachelor of Science degree in microbiology at the University of Oklahoma. A few years later, he completed a doctorate in dental surgery from University of Oklahoma College of Dentistry. I'm honored to host Dr. Manar Kabbani. Dr. Kabbani, welcome to Talk with a Professional.
Thank you. Assalamu alaikum, everyone.
So, Dr. Kabbani, if we're going to start, take us back when you were in high school and you were about to finish high school and looking at future career. So, what was on the mind of Dr. Kabbani or Manar Kabbani at that time, finishing high school?
Yeah, so honestly, in our high school, by the time I got to high school, it was probably the 7th graduating class. So obviously there's new experiences and, we're gaining new knowledge every year. So my experience was I was kind of just taking information from people that had done it before me and seeing what they thought about it. But for instance, my older brothers are in the medical field, traditional medicine. So that's kind of where I started. My thought process was I enjoyed healthcare and working with my hands. So I thought maybe, something surgical in the health field. Almost all of my friends, I'd say 90% of them were also pursuing something in the healthcare industry. So that's kind of where I initially put my path down towards pre-medicine in college. So that's kind of where I started.
So you finished high school. You went to Peace Academy in Tulsa, Oklahoma. You finished high school. So you went to start initially at a community college in Tulsa, and then you moved to University of Oklahoma.
Yeah. So while I was in high school, I was doing concurrent enrollment in the community college. So I finished almost a year. I graduated high school a year early. And then I finished almost a year of community college by the time I was done also. So I finished my associates in 1 more year and a half. And then I transferred to University of Oklahoma to finish the bachelor's.
Excellent. So when you moved to University of Oklahoma, what was your major at that time?
So at that time, it was still pre-medicine. I was, it's very difficult to say for certain, oh, this is exactly what I want to do. And I always tell people, don't make your decision too early before you have some experience in the actual field, experience speaking with people, experience shadowing people. So at that time, it was still pre-medicine. And so during college, I began that process of, talking to people, shadowing doctors, shadowing different specialties.
So basically, this is critical. So basically, if students in high school, if they want to, let's say, go to healthcare in general, my advice in general to students in high school, make sure you have very good grades, very good GPA. Make sure you write well. Make sure you do math well. Make sure you read well, right? Because that will open the door to go any college you want.
Yeah.
And study any field you want.
Yeah, absolutely. It really makes a big difference early on, especially when you kind of create a pathway for yourself of what you want to achieve in the end. That way you can kind of break it down into smaller goals and smaller skills that are needed to achieve those goals. I think it's really important for me. I personally recommend for people, like for instance, in my experience, my third year is when I really made the transition from medicine to dentistry. I was doing a lot of shadowing. I said, this isn't really what I feel comfortable in. I enjoyed, some of the specialties in medicine. And I really was leaning towards anything surgical. But I also had kind of an intuition for business and entrepreneurship. So that's kind of when I began, I opened my mind a little. I said, let me take a look at dentistry. One of my friends recommended it. So I began shadowing a lot of dentists, different specialties. And that's kind of what I felt more comfortable with. It had a lot more business aspects to it, a lot more freedom in terms of how I wanted to practice, and also a lot more surgery involved there. I could have a lot of surgery. So I made that transition officially, I guess, declared for it during my fourth year.
So this is interesting. Let me ask you this question. So during the first 2 years, you were in pre-medicine. So obviously you're taking biology courses, right? General chemistry courses. And you were shadowing people in medicine, right? And also you shadowed few dentists in the area. So how were you able to narrow down and zoom in on, I want to do something a little bit surgical. I want to do something a little bit entrepreneurial. I want to, but also you can do the same thing in medicine. I mean, what made that shift for you where you say, everything converges into dentistry? I like people to hear from you that critical thinking, because I think it's very beneficial.
Yeah, and I think the big mistake people make, especially during those early years, is people will ask themselves a question of, what do I want to do? I think the better question is, what don't you want to do? That way you can really narrow down and eliminate, absolutely, this is something that I just don't feel comfortable with, or something I really don't like. So for me, I knew I wanted to have, to be able to really set my own schedule, have my freedom of, delegating my work and practicing the way I wanted, which you can do it in medicine to some extent. I knew that I didn't want, I was very difficult for me. Traditional education is not really the way I learned specifically. It's just difficult for me to learn, the regular classroom with teachers and stuff like that. I'm more of extremely like hands-on and visual learning. So I knew from the get-go, okay, there are some specialties in medicine that I do enjoy for sure. If I wanted to get to those specialties, how long is it going to take? Really, that's a big topic that, really nobody tells you about it. It's a long journey. It really is a long journey. So you have to be prepared for that. It takes a physical toll and a mental toll on you. You just have to tough through it and really be able to have tough skin to be able to get through that. And it's not really different in dentistry. Dental school is extremely difficult in terms of what you're actually going through. But the difference is you have that freedom a lot earlier than in medicine. In medicine, you are required to specialize or do some type of residency, where in dentistry, you have the freedom of choosing if you'd like to or not. And I knew, actually, I didn't know that really what progressing after college is when, so my fourth year, I applied for, or I took the dental admission test, and I didn't get in my first year. So I took a year off. And in between those transition years, I said, and I'll get back to a point on this too, but I said, what are some skills that I can learn in the meantime that are really benefit me in my future, if this is truly the path that I'm going to pursue. So I went into sales, something completely different than what you think, medicine and all that stuff. And I went and started, learning some business. I went to sales. I started taking, mentorship courses about business, personal mindset, and trying to just expanding, getting different experiences and different thought processes. So kind of going back to that, in my fourth year, honestly, my whole thought process was, I'll do dentistry, I'll get a job, and then that's it, I'll be done. But after I got new experiences and new knowledge and stuff, I said, you know what? I think I can serve a bigger purpose, or, I can pursue what I truly want and create the life that I want. So that's when when I started dental school, my thought process was, I'm going to be getting out and going into ownership and expanding multiple offices and helping other people do the same, in terms of having them have their own financial freedom, their time freedom, and quality of life. That's really important.
I can stem from listening to you, the resilience, where, I have a year gap after college. I'm going to go back and retake the test, but I'm going to sharpen my skills and do what I like to do. It's 1 year, it's free. Want to learn something new. I'm not going to waste time. I'm going to pick up new skills. I'm going to retake the test and go back and retry again. That's beautiful.
Yeah. Wonderful. Yeah, and honestly, I took 2 years off actually, because by the time I had applied my 4th year, it was already the next transition year. So I had 2 gap years basically. And I think it's very difficult, especially when you involve peer pressure from parents. Not to say that they're wrong. Obviously, all the parents want what's best for their kids, and they have good intentions. But as a child, or as someone at that age, the added stress it's difficult. And so I always tell people not to stress out about, having a gap year, or I actually recommend it for some people, because you know what, you just went through 12, 15 years of school, and then you did 4 more years of college, and you never really had a break during that time. You were just experiencing the same over and over and over again. And that can be traumatic to some extent. So it is good to, just declutter and de-stress from that, and, have new experiences. Whether that's something, if you want to travel, or you want to work, or you want to learn new skills, it's very beneficial.
I agree. It gives you a level of independence, extra independence after you finish, and also it takes you away from the classroom. You finish, you earn the degree. Now you are on the verge of going into a new professional school, right? You basically finished traditional bachelor degree education, and now on the verge of going to professional school, and you're zooming in on dentistry. So I salute you. This is great. So you did. You learned a little bit of business. Tell us about the test. What test do you take to enter dentistry?
So dentistry has an admission test similar to medicine. They have the MCAT for medicine. Dentistry, it's called the DAT. Basically, they test you in math, math, chemistry, organic chemistry, biology, reading, and there's a perceptual ability portion, which it's scored different. It's scored on a separate scale, but some schools do weigh it heavily. It really just depends on what school you're applying to. Some schools don't really look into it too much, but it's really a combination of those things. So it's not too different from the MCAT in terms of what you need to study.
So when you take the test, help me here. What do you think is a good background? If somebody want to go into dentistry, what is a good scientific background? Should they get chemistry? Should they get a little bit of chemical engineering? What do you think it's good?
Yeah. So actually, that was the point I kind of wanted to get back to. For me personally, it's difficult before you experience something to know, hindsight. I personally, in terms of a college degree major, I would recommend to students pursuing something that they actually enjoy. Don't do something that's, just for this career. It's absolutely necessary, because you're going to end up having to relearn everything during school anyways. There's no such thing as, memorizing it once and you're done. You got it perfectly. You're going to have to continuously refresh your memory and all that. So me personally, if I was going back to college, I would still do dentistry. Of course, I really enjoy it, but I would probably do a different major, something more applicable in terms of skills. If you're doing a science degree, really what you're pursuing is either, if you're not doing medicine, you could use it for research, or laboratory work, or, some type of healthcare industry, where you're not necessarily learning skills, but more what you can do in such industries. So I'm big on, business degrees, marketing degrees, even health and exercise degrees. Those are very beneficial. Nutrition, stuff like that. That involves a lot of science even in there. So it's kind of a combination. So I really think it's more of a personality thing and what you enjoy. where, well, you still have to take some prerequisites, similar to pre-medicine, but at that point, you still have a different experience during that college degree.
Right. Thank you. So basically, I mean, it's open. Let it open.
Yeah.
I mean, let the person decide what science degree.
Yeah.
Because,
I think, I mean, my degree, I wouldn't say it drastically helped me in dental school. Some stuff, yeah, it was kind of a refresher and I had already learned previously. But like I said, at the end of the day, you're still going to have to put in the hours regardless.
so walk us through, you took the test. I mean, do you have to shadow a dentist, work in a clinic?
Yeah. So during my, I don't know if it has changed since then, but you are required to have 100 hours of shadowing. At least, I mean, it could be a specialty, general dentist, or so on and so forth, but you needed those hours in the application. And then you had the dental admission test, and similar to all the rest of the applications, a personal statement and stuff like that. The prerequisites from your degree.
And then an interview.
Yeah. So each school, honestly, their interview process is different. My first year where I applied, they were testing a new interview process. So they were kind of looking at different schools and seeing what they were doing. So they decided to try it for a year. Basically, it was the traditional interview was a or a two-person panel, basically one single interview with two people. But this new year, they decided to do 3 separate mini interviews, basically one-on-ones with 3 separate people. The issue they had with that was they were getting conflicting feedback from each interviewer. So it was difficult for them to kind of gauge what really went on and create a score system for that. So they decided to scrap that the next year and went back to the traditional 2-person panel. I know some schools that do multiple mini interviews where you meet 5 or 6 different people. And some people do kind of group interviews. So it's really just depends on the school that you apply to. But I think in dentistry, really it is, once you get accepted for an interview, then you're kind of 50% there. The rest of the way is kind of showing that you're social, you can interact well with people, you're passionate about the field, and and so on and so forth.
So basically, once they invite you for interview, it's just the interview, right, between you and getting it.
Yeah. Some advantages include, being in-state versus out-of-state.
Right.
It really just depends on the school. Some schools take a higher percentage of outer state. Some schools prefer in-state.
Okay. So you are now in College of Dentistry, University of Oklahoma. I mean, it's a great state school. Walk us through the 4 years of dentistry. How's it like, the first year, second year, and so forth?
Yeah. So really the whole dental school process is similar in most schools, but some schools differs in terms of how early you are exposed to clinical situations. So in my year, the first year was all, scientific classes, physiology, anatomy, biochemistry, all that stuff. And then they began to slowly expose you into dental sciences. And then progressing into your second year, you start to do hands-on training in simulation labs, working on your classmate partners, basically hands-on tutorials with supervision. And so in our school, between the last semester of our second year, we actually began working on patients. Very simple stuff, cleanings, very simple procedures. And then they kind of build on that, where you progress, your third year, you're doing more complex procedures. You're actually using hand pieces, doing fillings, and so on and so forth. And then you're exposed to rotations of different specialties, where you're still doing training in the simulation lab. So you have the background knowledge of what to do, but you're also doing it on patients, live patients. So the third year was a combination of didactics and clinicals, and then the fourth year was strictly clinical.
So the first year basically just didactic, just courses.
Yeah.
Then the second year you work on simulation.
Yeah.
Right? But then the second semester, you said you interact with patients or your fellow students.
Yeah. So like I said, some schools are more heavily focused on clinicals, which our school was. So we were exposed to that pretty early. Some other schools wait until later in the third year, or I mean, early third year to do that.
So when you work with a patient, do you, for example, get a case and you work on the case for some time? Tell us more about how do you work.
Yeah. So really, it is a school-specific thing, but traditionally, the way it works is patients apply to be in the school. Regularly, school patients, their fees are a lot cheaper than a traditional private practice, which is the way they kind of market and bring in patients for the students. So they're getting a lot cheaper procedures done. So the patients typically come in through a screening process first, and then a dentist that is supervising the student, they basically create a treatment plan or an overall exam of what this patient needs. And then based on that examination, that patient is passed on to certain students that need requirements or certain students that are, entering this rotation. And during that process, your third year, you're basically doing general procedures. So you're working up patients, learning how to do examinations, learning what to look for in patients, the basics. And then you're under supervision of a general dentist, a group of students for each kind of operatory, a group of 5 to 10 under each general dentist. And then your fourth year, you get a lot more freedom in terms of, they don't really micromanage you as much. You're responsible for taking care of the patient and knowing what you're doing. And if you need assistance, then that's kind of when you go ask for it.
Nice. So basically the faculty, right, which is a general dentist, will screen the patient, will identify the needs of the patient, and then will say, you need, for example, 2 fillings, you need extraction, you need cleaning, so I'm going to send you to multiple students, right? And each one will do one part.
So generally when you're passed to a student, you stay with that student for the rest of that student's schooling for basically those 2 years, and then they're transferred to the student under you. So the patients don't really hop between students themselves.
Oh, so one student basically can do extraction and filling and everything for the patient. Yeah. Nice, excellent. Okay. And then the fourth year, you are a little bit more independent. So you take clinic in the morning and you see patients.
Yeah. Generally, in your third year, you'll have 1 clinic spot per day, and your fourth year, you have 2 clinical spots. So you can see normally each appointment is approximately 3 hours. So however much you can complete in that appointment. But your fourth year, you have 2 slots of those. So basically 6 total hours. Sometimes it's even longer than that, where you can fit in, 2 patients or even 3 patients.
Okay. Now I need your help with this. I know in dentistry, there's ortho, there is endo. So walk us through the different areas of general dentistry, and then we'll talk after you finish, we'll talk about specialization. So tell us a little bit about the general dentistry area and the different areas within dentistry.
Okay. So currently there are 12 specialties, if I'm not mistaken.
12, okay.
General dentistry, basically, in terms of law, you're able to kind of do any procedure if you have the certification for it. Obviously, you as a dentist, you have to continue your education and continuously take courses to be able to re-license every few years. So as a general dentist, you can do almost any procedure. However, you can't market yourself as a specialist. You can't say, I'm a surgeon or anything like that, or an oral surgery or an endodontist. Whereas if you do specialize, then you're strictly limited to that specialty once you specialize. So as a general dentist, you're able to do, quite a variety of different procedures, but once you specialize, you're strictly limited to that specialty, which is you definitely get paid more for those procedures, but you have to really know this is what I really like and this is the only thing I want to do. For me, I enjoyed different areas and different specialties. So I decided to stay with general, where I felt like if I wanted to focus more on one area, I could easily do that by certifying in that specialty and getting more training in it.
So let me ask you this. So if you want to become more a specialized dentist, do you have to go back for residency after dentistry?
So their residencies, basically there's what we call a general practice residency, which is a single year. Basically, it's just more training in general dentistry. So you're still exposed to all the variety of procedures, but it's just more clinical training. You have more freedom and you're a lot faster pace than you were as a student. And then come into specialties, which, like I said, there's quite a few. There's oral surgery, basically, surgical stuff, and that's the longest. I believe it's 5 years, or you can also go through the medical route as well. And then there's endodontics, which is root canal specialist. There's prosthodontics, which is basically crowns and bridges and implant dentures. There's the removable prosthodontics, which is denture patients or denture dentists. There's pathology. So just like medicine, or you can specialize in pathology, there's dental pathology as well. There's the newest field is dental anesthesiology. Basically, you're doing sedation for patients, and that you can kind of do procedures in that. However, you can become certified as a sedation dentist, as a general dentist, by taking courses.
And pediatrics, right?
Pediatrics, children, yeah. There's orthodontics, which is braces.
So what's the difference between endo and ortho?
So endo is a root canal specialist.
Okay,
basically,
so that's somebody who can extract the nerve.
Extract the nerve and replace the fillings. There's, obviously more procedures involved in that, but that's the main focus of the specialty.
Right.
And there's also a periodontist, which is a specialist of the gums.
So what's the difference between perio and ortho?
So perio is a specialist of the gums and the bone. Basically, they do grafting for people that have recession. They do treatment of people that have bone loss. And there's a lot more extensive than that. Obviously, it gets very complicated. Right. Orthodontics is basically the specialty of moving teeth or shifting teeth to create a balanced bite. Right. And an even occlusion, meaning the teeth are aligned and the patient's bite is aligned to reduce stress for the patient, and as well as aesthetics. So.
And those are the ones that work on people where they installed bracelets.
Yes.
Right? Okay. To align the teeth.
Yes.
Got it. Interesting. So you learn a little bit of that in college, right? And then you have to take courses or do a residency to specialize.
Yes. So you learn basically all of these, the basics of all of these specialties in school, and you do procedures in the specialties as well during school. But once you're done, it's kind of on you to decide where you want to focus on, where you want to get more advanced training on. So a general dentist can do orthodontic work. He just takes additional training for it, learning different procedures and kind of the more advanced knowledge and specific knowledge required to do certain procedures and understand what needs to be done.
So what about plantations? I mean, if somebody extract a tooth and they implant, tell us a little bit about planting a tooth.
So implants are basically the newest advancement in dentistry. It's the gold standard for replacing teeth. I mean, obviously the best situation is having your natural teeth, but implants are the next best thing. They're not exactly the best, not exactly the same as natural teeth. You can't really replace that, but it's the next best thing. So that entails basically either extracting a tooth or a patient that's already lost a tooth. A titanium implant is screwed into the bone, the jawbone, or the upper maxillary bone, and that kind of fuses with the bone and creates basically a single root, which replaces the root of the teeth, which kind of acts like a trunk of a tree. And then on top of that implant, a crown is placed to replace the top part of the tooth there that you chew with.
So how long would this live with a person?
So really, right now the success rates are, I mean, in the 96%. So there's really good percentage of success. It mainly depends on the patient and their maintenance. So with implants, there are certain things you need to do to maintain. You have to have really good hygiene and continue to visit the dentist for special cleanings as well as maintenance. Obviously there's factors that affect this, like smoking, diabetes, and all these type of issues can have their effects on it. But the success is very good currently. So they have the potential to last a lifetime, or they can fail early. It just depends on really the patient and how they were placed.
So maybe if you can quickly tell us, I know, I mean, the area of dentistry is, I mean, sometimes you can have a certain disease that can influence your teeth or influence your gum.
Yeah.
So if we can just summarize certain diseases that can influence gum and teeth, what can you help people to learn so they can really take care of their teeth?
Yeah. So basically the very basics is the mouth has a certain pH level. It's basically a neutral pH level. And once it drops beyond that to the acidic portion, in the pH 5 level, that's when you start to get a lot of bacterial attachment onto the teeth and in the gums. So once you get bacterial attachment in that area, you begin to have inflammation of the gums, which is what we call gingivitis. Basically, the kind of puffing and the redness of the gums around the teeth. That's basically the beginning infection of bacteria. If that's left untreated, then that progresses to what we call periodontitis, which is it begins to infect the bone underneath the gum. That's where you'll start to have bone loss and gum recession, basically exposing more of the tooth. And that can create more sensitivity, that can create tooth mobility. And also going back to this, that same bacteria, once it coats the teeth and attaches to the teeth, basically you can't get rid of plaque without mechanical abrasion. It requires either a toothbrush or some type of mechanical stimulation to remove it. So this is why we recommend your toothpaste, your mouthwash. Mouthwash, basically a fluoridated mouthwash, acts as an extra layer on the teeth that prevents those bacteria from sticking to it. So the more fluoride you can have attached onto the teeth, it kind of acts as a defense barrier and increases that pH level, so you don't increase or add more bacteria to both the gums and the teeth there. If those bacteria are left on the teeth for too long, then they begin to progress inside the tooth and create what we call as a cavity. That's basically where it requires a filling. And from that cavity, if it continues to be untreated, it will reach the nerve, and that's where you'll have a periodontal infection and an endodontic infection, which requires either an extraction or a root canal.
Right. So in general, you're advising people to brush maybe once or twice a day.
Yeah. So
clean between the teeth, right? And use the mouthwash and visit the dentist every 6 months to remove the plaque around the teeth.
Yeah. So the general protocol is we're brushing twice a day, morning and night, most commonly. Some people do it in between meals. That's also really good. You want to floss at least once a day. I tell patients to floss at nighttime. That's kind of the end of the day where you're removing anything that was left in between the teeth. That's kind of where most of the people get the cavities if they don't remove what's between the teeth, because you have tight spaces between the teeth. So you get bacteria stuck in between there and they create cavities on the sides. That's kind of why the importance of flossing is. Mouthwash, like I said, acts as an additional defense barrier. So your brushing and your toothpaste are going to act as that mechanical stimulation to remove the plaque. Really, the best thing outside of that is your diet. Your diet plays a huge factor in terms of how frequent you build plaque and how frequent you get cavities and bacterial attachment. So if you have a highly acidic diet, meaning sugary drinks, soda, chips and snacks and all that, and you continuously eat that stuff and it's just coating your teeth, that's kind of where that pH level continuously drops and it starts to get cavities and infections. So we always advise patients anytime you do have any sugary drinks or any acidic foods or anything like that to always rinse out with water afterwards. Simply rinsing with water can kind of reestablish that neutral pH and wash away that acidity from the teeth. So that'll act as an additional defense barrier. So it's kind of just monitoring that.
That's a great advice. So every maybe after acidic drink or soda drink, just maybe drink water, right? To eliminate and remove any residues of the drink.
Yeah, obviously the best is avoiding it, but I mean, we all have our own love for certain stuff. So as best as we can, just rinse out with water afterwards. And patients make the mistake of actually brushing immediately after having those types of foods. It's important to wait after you rinse out with water, I would say about 20 to 30 minutes to brush. That way you're not actually brushing that acidity into the teeth. So we want to get that off before we actually brush it in. So
great, wonderful. So Dr. Kabbani, I mean, you started your own clinic in Dallas. So tell us more about the clinic. When did you start?
So I graduated in May. And like I said, at this point, I already knew I definitely wanted to go into ownership and go that route rather than just working at an office. So I started out working at an office, and I currently am working still at an office full time. I'm currently working on transitioning into ownership. So I'm in basically negotiations with another practice to purchase their practice and take over. There are many different routes to ownership, and there are many different routes to being a general dentist or a dentist in general. Like you can simply just have a job, you work your days and you go home and that's the end of it. But like I said, you have the freedom to expand and do as you please in terms of going either into ownership.
Yeah, so let's talk a little bit about a transition. So you finish college, and if you wanna be the owner of the clinic, so would you try maybe in a partnership first and then slowly purchase? What do you advise?
So that's really a good question. Like I said, there are many different routes to getting to that goal. It really just depends on your personality and how much risk you're willing to take and how comfortable you feel taking that risk. I would say that 80 to 90% of people coming out of dental school are not quite ready to make that transition. So they generally either go work for a few years at either a corporate office or a private office. And then they either stay working as an associate or they decide, I kind of wanted to go into ownership. That's where you see basically the majority of people. For me, I knew early on, I had business experience and I've taken, management courses and all that. So I knew early on that I wanted to go directly into ownership. So ownership, you can purchase a practice from an existing dentist, or you can start your own. Starting your own is difficult if you're not known, and if you don't have basically a large amount of cash. Whereas purchasing a practice, it still requires cash. However, there's already a practice running, so you have some cash coming in, some cash flow. So it's a little easier to begin that route. Whereas expanding, then you can kind of pursue into building your own and going from there.
Nice. So where are you now in the process?
So right now I'm in the process of transitioning into becoming the owner of a practice. So I'm working at one practice, and I'm negotiating with a different practice to purchase them and become the owner there.
Okay, wonderful. So next year, maybe in 2022?
Yeah, possibly middle of this year to later this year, inshallah. So
excellent. Any plans to employ other dentists in your practice?
Yeah, absolutely. That's really my personal goal. I want to employ multiple dentists. That way I can focus on different things as well. Um, and also I want to have partners where um, they kind of can experience the same business aspect, or dentists that have the same entrepreneurial spirit. They can have the same goals as me as well, so we can kind of pursue together, maybe possibly on smaller scale, in smaller practices or multiple practices.
Because I see now there are clinics that specialize in pediatric dentistry. There are clinics that focus on specialized. So where do you see yourself in 5 years? What do you like to do?
Me personally, like I said, I really like surgery. So as practicing myself, I do almost all the procedures, but I do see myself get involved heavily into implants and surgery, um, and then kind of having multiple dentists that specialize in different procedures working with me as well.
Interesting. So in a few years, you're going to have a dental center where people.
Hopefully, yeah.
That's wonderful.
Inshallah,
That's
inshallah.
wonderful. So in the next few minutes, what advice do you have for students, high school or kids in college, and who are interested in the profession of dentistry? What advice do you have for them?
Yeah, I'd say if you're truly interested in the dental profession, speak with as many people as possible that are either dentists or faculty at a certain school in your state. They have a lot of insight as to they've kind of been there, done that. Whereas, as also shadowing as much as you can. That's really the only thing that will get you as close as possible to the real experience. Because dentistry outside of dental school is very different than dentistry inside of dental school. In dental school, you're kind of, like I said, micromanaged, and kind of like you're still basically like a mother, father, and a child. So they're still holding you. You haven't grown your wings yet. Outside of dentistry, you're really it's on you to kind of perform at a much higher pace. And there's a lot more involvement in terms of what your responsibilities are. So like I said, always I recommend people reach out to dentists and specialists. Majority of people, dentists and specialists, they're very easygoing, and they would not mind at all having a student shadow them, and they actually love it. They love to talk about it. So I really recommend reaching out and doing that.
At the personal level, I mean, I see dentists all the time. I mean, they're using their hands. And so what kind of skills do you advise people if they're going to use their hands all the time? What should they have others don't, for example?
Yeah, really. It's funny because it's really the topic of when you're in dental school. That's really what it is. People, I mean, some people, they call them hand gods, basically. They're really excellent with their hands and what they can do. Whereas sometimes those hand gods, they're socially awkward sometimes, where they don't excel in different areas. So as a dentist, there are multiple areas where you have to, kind of put your effort in and really hone those skills. The hand skills is really only one portion of it. And honestly, that is really developed during dental school. Even if you don't think you have it, but you like the profession, that type of skill is something you're heavily exposed to during dental school, and something you will naturally gain experience and more advanced skills while you're in school. So I wouldn't really over stress about, I'm like goofy with my hands or something, so that you're taught the proper way to do it in school, and you have plenty of hours training on it. So
excellent. Thank you very much for the advice.
yeah.
Dr. Kabbani, I mean, it has been a pleasure having you on Talk with a Professional. I want to thank you for this opportunity to go into the profession of dentistry and learn about what dentists do and the different areas. So it's very fascinating. So
Yeah, Jazakallah khair. I really appreciate it, and I love speaking with people, especially that are interested in the field. So if you want to give my contact information out, I would be more than happy to speak with anyone that has more questions or anything. So
thank you so much. And to our viewers, thank you very much for listening to Talk with the Professionals. And until the next episode, thank you. Wassalamu alaikum wa rahmatullahi wa barakatuh.